Hi dear friends, welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. How coronavirus got started? The novel coronavirus outbreak, which began in Wuhan, China in December, has expanded to touch nearly every corner of the globe. Hundreds of thousands of people around the world have been sickened and thousands of others have died. Health authorities in China confirms that dozens of people in Wuhan are being treated for pneumonia from an unknown source. Many of those sickened had visited a live animal market in Wuhan, but authorities says there is no evidence of the virus spreading from person to person. On January 11, 2020, China reports first novel coronavirus death. Chinese state media reports the first death from novel coronavirus, a 61-year-old man who had visited the live animal market in Wuhan. On January 21, 2020, first confirmed case in the United States has been reported. A man in his 30s from Washington state who traveled to Wuhan is diagnosed with novel coronavirus. Japan, South Korea and Thailand also report their first cases one day prior. Now we look into coronavirus symptoms and how does it spread. According to WHO, World Health Organization, the most common symptoms of coronavirus are fever, tiredness and dry cough. Some patients may also have a runny nose, sore throat, nasal congestion and aches and pains or diarrhea. Some people report losing their sense of taste or smell. About 80% of people who get COVID-19 experience a mild case, about as serious as a regular cold, and recover without needing any special treatment. About 1 in 6 people, the WHO says, become seriously ill. The elderly and people with underlying medical problems like high blood pressure, heart problems, diabetes, or chronic respiratory conditions are at a greater risk of serious illness from coronavirus. Do's and don'ts. Do's: wash your hands regularly for 20 seconds with soap and water or any alcohol-based hand rub. Cover your nose and mouth with a disposable tissue or flexed elbow when you cough or sneeze. So, avoid close contact 1 meter or 3 feet with people who are unwell. Stay home and self-isolate from others in the household if you feel unwell. Don'ts: don't go to crowded areas. Don't touch your face. Don't be in close contact with others. Don't ignore the symptoms. Don't leave your home, especially if you are sick. What are the treatments of coronavirus? Vaccination. There is currently no vaccination to prevent coronavirus disease. Treatment. There is no specific medicine to prevent or treat coronavirus disease. People may need supportive care to help them breathe. Currently, no antiviral medications is recommended to treat COVID-19. Treatment is directed at relieving symptoms and may include pain relievers such as ibuprofen or acetaminophen, cough syrup or medications, rest and fluid intake. About self-care management. If you have mild symptoms, stay at home until you have recovered. You can relieve your symptoms by rest and sleep, keep warm, drink plenty of liquids, use a room humidifier or take a hot shower to help ease a sore throat and cough. If you develop symptoms of coronavirus and you have been exposed to the virus, contact your doctor. Tell him or her if you have traveled to any areas with ongoing community spread of COVID-19. According to CDC and WHO, also let your doctor know if you have had close contact with anyone who has been diagnosed with COVID-19. Your doctor may determine whether to conduct tests for COVID-19 based on your signs and symptoms. To decide whether to conduct tests for COVID-19, he or she may also consider whether you have had close contact with someone diagnosed with coronavirus or traveled to or lived in any areas with ongoing community spread of COVID-19 in the last 14 days. To test for COVID-19, your doctor may take samples including sample of saliva, nasal swab and throat swab to send to a lab for testing. If your doctor thinks you can be treated at home, he or she may give you special instructions such as isolate yourself as much as possible from family and pets while you are sick and to stay home for a period of time. If you are very ill, you may need to be treated in the hospital. Thanks for watching this video. Please subscribe and share this video with your friends. Stay safe. Have a nice day.